It's not as much. Okay.
Right. So, in addition, we think you actually covered this. Well, yes. I have a press release
What you're doing is
I'm just going to, we're assuming that this would be in the spine, and I'm going to show you how we can turn the screw without touching that. So assume that this is kind of the skin and tissue behind the implant. And you can see here, I'll pull it over this one, you can see how this magnet, when it turns, actually turns the screw. In short, what we have is a magnetic field that we can turn that turns a magnet on each screw. And so we can do that without directly accessing each of the screws. And what that means is that we're able to adjust the implant from outside of the body without creating a surgical opening in any way. So what that means to patients is that right now the current treatment algorithm is to do a revision surgery or an adjustment surgery every 6 months, which requires an open incision. There's lots of effects of open incisions, including, not to be minimized, the risk of infection. If you have 12 different surgeries, you have an extremely high risk of having a severe infection during that time. This eliminates the need to do some of those adjustment surgeries, and it can be done in an outpatient setting even.
Okay, go ahead.
Flip?
Yeah.
It would enable us to do these serial interval lengthenings of the spine, which simultaneously controls their spinal curvature or deformity and enables and encourages spinal growth. Ultimately, in the outpatient setting in an awake patient without an incision. And so it'd be truly non-invasive and would not require hospitalization, would not carry with it any of the risks involved with anesthesia and open surgical procedure.
not as much. Okay.
So, in addition,